Chickenpox is a common childhood illness caused by the varicella-zoster virus. It's very contagious and spreads easily from person to person. Known for its itchy, blister-like rash, chickenpox typically lasts about a week. The rash starts as small, red bumps, turns into fluid-filled blisters, and finally crusts over. Other symptoms include fever, headache, and fatigue. Thanks to vaccination, cases have dropped significantly. Recognizing the symptoms early can help in managing the disease effectively. The disease is most contagious a day or two before the rash appears. Knowing these basics can help in preventing the spread of chickenpox. The varicella-zoster virus is highly contagious, spreading through the air and direct contact with blisters. After exposure, the virus takes about 10 to 21 days to develop. It enters the body through the respiratory tract or eyes, then spreads via the bloodstream. The immune system's response causes chickenpox symptoms. The virus is most contagious a day or two before the rash appears and remains so until all blisters crust over. After recovery, the virus becomes dormant in nerve tissues. It can reactivate years later as shingles, causing a painful rash. Shingles is more common in older adults and those with weakened immune systems. The varicella-zoster virus is part of the herpes virus family, which includes viruses causing cold sores and genital herpes. Unlike some herpes viruses, varicella-zoster usually causes symptoms only once, as chickenpox. However, it can reactivate as shingles, especially in those with weakened immune systems. Understanding the virus helps in managing and preventing both chickenpox and shingles. The most well-known symptom of chickenpox is the itchy rash. It usually appears first on the chest, back, and face, then spreads to the rest of the body. The rash goes through stages: small red bumps, fluid-filled blisters, and crusting over. Before the rash, many people experience fever, fatigue, and loss of appetite. The itching can be intense, making it important not to scratch to avoid infections and scarring. The number of spots varies. Some people get a few dozen, others hundreds. Recognizing these symptoms early is crucial for seeking medical attention. Knowing what to expect can make dealing with chickenpox easier. While there's no cure for chickenpox, managing symptoms is crucial. Avoid scratching to prevent infections and scarring. Calamine lotion, oatmeal baths, and cool compresses can soothe itching. Antihistamines may provide relief. For fever and discomfort, use acetaminophen, but avoid aspirin and ibuprofen. Staying hydrated is essential, especially with a fever. Soft, bland foods can help if the mouth is sore. In some cases, antiviral medications like acyclovir may be prescribed. These are most effective if started within 24 hours of the rash appearing. Antivirals are usually for those at high risk for complications, like adults and pregnant women. Good hygiene is important to prevent bacterial infections. Keep fingernails short and clean. If blisters become infected, antibiotics may be needed. Signs of infection include increased redness, warmth, or tenderness around a blister. Contact your healthcare provider if you notice these signs. Proper care and hygiene can help manage chickenpox effectively. The best way to prevent chickenpox is through vaccination. The chickenpox vaccine is highly effective, preventing the disease in about 90% of recipients. The vaccine is typically given in 2 doses. Chickenpox spreads easily through the air and direct contact. If exposed, The vaccine can still help if given within 3 to 5 days. Vaccination helps protect the community through herd immunity. By getting vaccinated, you protect yourself and others.